So you see, we talked about how pandemics are born in the first part. They are born out of media frenzy, spreading fear, panic, not exactly born out of real effects of a virus or of any strain on ground. No, the biggest pandemic actually happens in the media circles. That's the, that's the biggest pandemic that we suffer. They first of all break the news. After breaking the news somewhere, breaking how we react to breaking news, we think it's something important and big. So they tell us how two people are affected somewhere, and then after that, two people who are infected somewhere, they start to tell us all this all round coverage. Every media house catches on. World Health Organization, the Director General takes over the spokesmanship regarding the new outbreak. And, and by the time that outbreak is getting to about, 4 people, they have already declared it a public health emergency of global proportions or of global concern. Again, and who starts to pump us with all the fear, with all the guidelines, which are not meant to guide, which are meant actually to fear, to get us fearful. But we ask ourselves, so why are they doing that? They are doing that for one thing. One thing is control, control and control and control. Why? Because people are we usually are easily, or we easily surrender our rights and liberties in times of crisis. We do not think twice. The only thing that we think about is survival. And now that's what they try to, to leverage the fearful nature of men. That when you spread enough panic and enough fear to a certain threshold, humans will be willing to give up their rights to a certain magnitude. So, but then, why are they driving this? Or how are they driving it? So, for example, I'll give you there's been a drive to have a World Health Organization put up a treaty, this pandemic treaty that they've been talking about for a couple of years now. A pandemic treaty that will have every country that is a signatory to World Health Organization bow to the rules and decrees of World Health Organization whenever this World Organization declares a pandemic. That's say, if Uganda were, are signatories to who, or Kenya is, Tanzania is, mention all countries that are under World Health Organization. That if World Health Organization comes up and says, you know what, the hantavirus is now, a threat, a public health emergency of global concern. Therefore, we as World Health Organization have declared, we are declaring, every country should, as a way of containing this emergency, every country should institute curfews, should put curfews where their citizens are home by 5 p.m. So every country that is a signatory to the World Health Organization starts to effect that. If they say lockdown because this hantavirus, which is on a certain ship somewhere, cruise ship somewhere, yes, so all of us let us lock down. Every country under World Health Organization starts to lock down. When they say, you know what, no, let's stop the flights, the flights, people flying out, no, let's limit that only to essential people. Every country under them gets on board and start to effect that. So this is about control, concentrating power into multinational organizations led by people never elected. Now we here are here screaming about sovereignty, sovereignty, sovereignty. Where will be the sovereignty in that? When we surrender our powers to foreign entities, foreign bodies, whose constitution comprising of people we don't know, we never voted for. Who is in charge of those people? Who appoints them to those places? Those are people you should even be more worried about. But this is about control. That an organization that seeks such control over the world, that its decrees are effected on a global scale, do you think such an organization will stop at anything from declaring pandemics? When there's that, hope, that lure, that appetite to gain more control? They say power corrupts and absolute power corrupts absolutely. It is power that they are looking for. controlling humanity. But how are you going to control humanity? One, spread fear and panic so that people can willingly give up their rights, or they can understand when you tell them to lock down. Some will even demand it, and the paid experts will even justify it. But the other thing is, this pandemic treaty is to get our sovereign powers from sovereign nations to and hand them over to who? So that this World Health Organization can declare one pandemic after another. Before the antivirus is over the horizon, now there is Ebola, now there is that. Do you think we shall have a shortage of pandemics when people are so much drunk on power and control? No, they won't. The one we shall be going on, of course, in this one of the key pillars they talk about in this pandemic agreement or treaty, they say that there's a pillar called the One Health approach. That One Health approach that they recognize the deep interdependence of human, animals, and ecosystem health to prevent, I think this is under the One Health meaning we are one in regard to responding to these health situations and health crises we are facing. We are one. Don't respond to it in an isolated manner. Say, for example, if I'm President Magufuli and I look at this COVID, stuff that's going on, and I say, no, 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 here it's not a big deal. Guys, use your herbal things that you've been using all through, and you'll be fine. No, 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 no. How can you? Do you know who came from Magufuli? It's the media. It's the experts, paid experts, or sold out experts. Those are the people. No, 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 no. We can't do that. What? That's not science. Listen to the science. Listen to the science. Wasn't the man right? Wasn't the scientist? But no, they don't want isolated solutions. They say we are one health. We are all supposed to listen to this one entity, World Health Organization. If it gets it wrong, we all fall off. So if a virus has sprung up deep down in the rainforests of whatever, in North America or South America, no, don't handle it in isolation. Don't use your local methods you've used for centuries to treat flu. No, no, no. Now it's One Health. It's a global concern. Now we come in with, now who comes in with guidelines? Guidelines to intimidate a person staying in Kampala. You understand? So One Health, we are one, don't respond to the things in isolation. No, they are so important. That's how they want to gain control. That even things that we used to work on yourself, all ourselves in isolation at home, now they are being castigated. We saw during COVID how experts were telling us that these herbal remedies that we have used, people have used locally for decades, some for centuries. No, they are bad. Herbal things are bad. Herbal things are bad. Our local experts, more like salespeople, were the ones, talking ill of these solutions that we had. But this is all about control. I'll give you an example here that more to allude to the pandemic treaty that they want to pass. I think they want to pass it next year, where who will be in charge of anything health. World Health Organization will take charge and start to decree what every nation should do. Lockdown, curfews, what? No school, no gatherings. Don't go to worship. Don't go to school. Because, hey, you guys in Kampala, please lock down. Why? Because there's a virus we found on a cruise liner somewhere near Spain. This is what the World Health Director, Tedros, said on May 19, 2026, while addressing the 79th World Health Assembly regarding Ebola. This is what he said. The COVID pandemic has exposed many gaps in global health security. The pandemic has what? Has exposed many gaps, therefore, and taught us all many lessons. We recognize that we need to reform the governance of global health security and bring everything together into a cohesive whole. That we need to bring everything in terms of responses to these pandemics. We need to bring everything in a cohesive whole, not isolation. Global governance, reform the governance of global health security. Global health security where everyone is acting in isolation. We need to have this cohesive whole under one health. Okay. He wants all power concentrated in World Health Organization regarding health. And then they say at this assembly 2 years ago, that's I think 2024, member states adopted a set of amendments to the international health regulations. Member countries adopted a set of regulations to the international health regulations, a set of amendments, sorry. And last year you adopted the WHO pandemic agreement, which I've told you about, a landmark instrument of international health law, landmark that is going to concentrate power in the hands of World Health Organization. The organization that wants power and control over you also has the right to declare a public health emergency of global concern. So do you think it will stop at anything to declare global health pandemics? No, because it wants the power. So, and it's time for a renovation to build a new global health architecture fit for the future. That new global health architecture is an architecture where there are rules coming from World Health Organization to be applied globally. Don't question. Yes, we just lived through that. With all this COVID stuff and the standard operating procedure, they're not coming from here. They're dictated from above. Yes, they dictate lockdowns, they dictate. That's why you see that all countries, generally speaking, responded the same way. Do you think we're all listening to independent scientists that somehow all reached this conclusion? No, it was one entity decreeing everywhere. But you see that is looking at governance of global health security, bringing everything together into a cohesive whole. No fragmentation in regard to responses to these pandemics. So this is about control. But because they know fear drives people to give up all manner of reason. They act emotionally, they all act in a certain manner. We are looking for only survival. And that entity that is promising us security, we shall listen to them. Even if they tell us lockdown, we shall lock down. They tell us curfews, we shall argue curfews, don't walk here, we shall argue, don't walk. They tell us don't take kids to school, we shall lock them down for 2 years. They tell us don't worship, we shall close the churches, the mosques and whatever, because we are looking at only what? Survival. We can easily give up our liberties for survival. And that's what they're leveraging. That's what they're latching on. That's what they're exploiting by declaring pandemics. And then we give up as more rights as possible. Give them up. And as we give them up, who regains more power? It's the World Health Organization. And especially under that World Health, pandemic treaty or agreement that they want to pass. So all these pandemics that are being manufactured or being born that keep springing up are public health emergencies of global concern that keep springing up all the time. Before one is over the horizon, another one is beginning, and then another one. It's all about this. It's all about control. All right, we shall return in the next part and we look at other things, why they are doing this. Okay.